So in the state of Connecticut, we believe that meeting people where they are, finding out what their needs are within the healthcare community, and being able to provide them with some of that helps us to build that trust. And without trust, we're not going to be able to improve the odds on healthcare in Connecticut. We really want to work towards hospital aversion. We want to work towards patient-centered care. And if we don't ask people what it is that they want, we're not going to be able to provide them with that patient-centered care. Along with that, when we look at population health and we look at long-standing chronic conditions in our state, some of our communities are third generation with whatever the problem is, whether it's alcoholism, whether it's COPD, whether it's because we haven't been able to get to the people to find out what it is that they want, what they need, what they don't understand, what they don't have. Is it the social determinants of health? Is it not having enough money to buy the meds? Is it not understanding that you have to finish a 14-day course of antibiotics? We're not going to have the opportunity to teach them those things unless we get them to trust us. And to be able to trust us, we have to find out where they're at. We have to go to where they are. We have to talk to them about what their needs are, what their fears are. Why is it that they're not accessing help? Is it because they are fearful for the finances? Is it because they're fearful that someone might come in and take their children away from them? What is their fear? And why do they have that fear? And why can't we build more trust with them to have them be more disclosing of what their concerns are? And once we can build some trust, and once we can break down some of the barriers, and once we can see what it is that's keeping them from accessing health, from accessing insurance, from accessing care, then I think that's when we're going to see an increase in our healthiness of our population in the state of Connecticut. We have a responsibility to help people live healthier. We have a responsibility for their level of functioning in this life to be the best that it can be. And we're picking up people far too late in life where they've already developed a lot of habits that aren't in their best interest. If we can get to folks younger, if we can even get those folks to let us in to talk to their daughters and their granddaughters and grandsons and sons and neighbors and friends and say, you need to listen to these folks, because if I had listened way back when, I'd be healthier now. What is life if you're living it with a poor quality of health? It's not what it could be. If we could harness the wealth of knowledge that we have in our seniors in our state today and have them be part of the teaching for our younger generations on what they did right and what maybe they did wrong or wish they could have done a little differently that impacted their health, their level of health now at this stage in their life, I think that would be extremely impactful, not just for their individual families, but for our entire population.